Zins, Chairman of the Department of Plastic Surgery at the Cleveland Clinic Foundation. This is my partner, Dr. Rafael Couto, who is the first author on our paper, Age as a Risk Factor in Abdominoplasty, which will be appearing in the Aesthetic Surgery Journal May edition. What do you think was the most important finding of your paper?
Well, first of all, to give a quick recap of our study, in our retrospective comparative patient study, we examined the safety of abdominoplasty in the elderly population by comparing the complication rate between older age and younger age patients. We examined major, minor, and local systemic complications occurring before and after 30 days from surgery. What we found, the most important finding of our study, was that abdominoplasty can be safely performed in the elderly patients with a complication rate that approaches the younger age patients. And stating another way, it seems like physiological age perhaps is more important than chronological age.
How do you explain that finding, which really is perhaps a little bit counterintuitive? Many of our sister services have really found just the opposite, and that is that with increasing age, we see increasing risk of complications.
Yes. Unlike other specialties, plastic surgery has the luxury of deciding not to perform surgery on a patient with poor health. And this ability of pre-selecting our patients may explain the difference of our results in our review compared to other studies. This careful patient selection can be observed in our cohorts, where 80% of our patients had a score of ASA score of 1 or 2, and no patient had a score greater than 3.
This extends the findings of previous work from our unit, where we looked at age and facelift surgery. And what we found in that study was that with proper selection, patients 65 years and older could be operated on with a similar complication rate as those patients less than 65 years old in the facelift population. Thank you very much.